8-year-old female. She's a known history of CA breast, operated 5 years ago with left mastectomy, and now she presented with cough and dyspnea.
نعم. Now, these are the axial sections of a CT chest of a 58 years old female known for breast malignancy. Seems to be treated by mastectomy. There is no evidence of the right breast. There is evidence of consolidative lesion in the left lung field, occupying most of the عفوا دكتور أحمد إذا تقدر تنطيني كورونا من فضلك.
أي نعم دكتور.
نعم. The consolidative lesion seems to occupy most of the left upper lobe with a large عفوا دكتور أحمد من فضلك إذا تسمح أرجع على الأكسيال هذا مو كلش مفيد. نعم. The consolidative lesion of the upper posterior segments of the upper lobe. There is a large cavitary, thick-walled cavitary lesion involving most of the upper part of the lower lobe, thick-walled with surrounding ground glass changes. No internal masses as far as I'm seeing. دكتور أحمد إذا تحب proceed please. وإذا عندك نعم أشتدك. From the visualized part of the abdomen, there is mild enlargement of the spleen with a solitary focal hypodense lesion in the anterior aspect of the spleen. نعم. mediastinal window عندك دكتور؟ نعم. نعم. هاي البون ويندو أي براحتك. The cavitary region seems to be thick-walled. وهذا الconsolidation contain aerobronchogram.
دكتورة رشا احنا in conclusion يعني هذا الليجن a correlation ويا الهيستوري مالتها العلاقة.
ال presence of cavitary lesion لا يمكن نمشي ويا post infectious process أكثر و thick walled.
زين.
نعم. ما أعرف إذا ماخذ contrast للبيشنت أو إذا أكو enhancement بالوالز مال هذا الكافيتري ليجن. إحنا دائما من عندنا patient عنده primary we attribute most of our finding to the primary ونشك إنه هذا ممكن يكون secondary deposits in the lung.
بس هو
مو شرط بالضبط. وهسه حاليا هذا الشكل مال الكافيتي irregular وبي thick irregular walls.
الدزين على المريضة شو تسوي بالهيستوري؟
إذا ماخذ كيموثيرابي.
إذا ماخذ كيمو، إذا ماخذ راديوثيرابي.
صحيح؟ نعم. نعم.
وبعد
كيمو.
يعني إذا كانت immune compromised البيشنت.
نعم هو يعني أكيد هي إذا ماخذ كيمو أكيد إحنا ندور على immune compression وإذا ندور.
She is on chemo and radiotherapy for months ago.
إيه شفتي؟
نعم.
واحد على كله يفكر بيها ويخليها بباله على مود يكون كومبليكيشن مال كيمو، كومبليكيشن مال كيمو مال راديو ثيرابي، مو صحيح؟
نعم. هو بالضبط ال presence of consolidative lesion بهالحجم بالarea of irradiation usually points to the area of irradiated chest، فاحتمال هاي تكون pneumonitis radiation induced pneumonitis، خصوصا
وبعد
إذا
ممكن
احنا
شنو؟ غير النيومونايتس ممكن شنو؟
يعني هو radiation induced changes أو يكون lymphangitis carcinomatosis.
lymphangitis carcinomatosis بعد ممكن شنو؟ كسيكولي مال راديشن مال هاي شنو؟ غير الهاي لانج فايبروسيس ما ممكن مثلا؟
الفايبروسيس اي نعم استاذ، هو الفايبروسيس
عادة الفايبروسيس لونج هيستوري يعني بريفيوس
اكثر من سنه.
شهر
نعم.
وهذه اي
نعم اكثر من سنه
بالضبط.
نعم.
اي
نعم.
فهاي كل الاشياء تؤخذ بنظر الاعتبار. could be infection وصار complication يعني cavitation بعد شو السيليا بالهيستوري مهم. يعني هي صح مسويه ماستكتومي وهاي بس عندها كافيتي والريجولار وول باللانج وول. شو تسيليا على الهيستوري؟ بالهيستوري البيش مسيليا على السموكينج؟
اي طبعا ايه اكيد. انا اسفه فاتتني بس لانه هي فيميل توقعت انه يعني
بس
المفروض طبعا
ما تفوتش بنتي.
اي لا صحيح. السموكينج كلش مهم.
انت اكو يعني اكو بيشنت هم حتى يعني مالجننت وسيا بس هو هيفي سموكر وصارت عنده مثلا برونكيال كارسينوما، مو شرط يعني لها علاقه بالهذه. زين
تمام. خصوصا الماس سنترال
مرضى بالذات فيميل يعني هي هيفي سموكر وش اسمه وهذه، فهاي الاشياء كلها تخليها ببالك وش اسمه. فان كونكلوجن كافيتري ليجن بالليفت لانج، اذا تلاحظين حتى الليفت لانج السايز مالتها
سمولر.
اي
نعم.
مشي يا احمد شويه مشي بالله. زين. one have to exclude another pathology بالتي.
تمام اكيد استاذ.
وش اسمه ايه يعني.
هاي هنا احنا عندنا بالرايت ريب اكو رايت انتيريور ريب اكو سكليروتيك
ليجن. هذا طبعا تشينجز مال الراديشن.
مع راديشن. تمام.
بس هو هذا برونكوجرام ويا كافيتي، فيعني تتخلى ببالي باب الكونسوليديشن. اي هنا كل شيء برونكوجرام. الاوسوفيجاس شنو رايك بيه؟
الاسوفيجاس بهذا الليفل seems to be a bit dilated وthickened with focal thickening of the wall.
مو صحيح المين تكندو وهذه. اوكي شكرا عيني رشا. يلا احكي لنا احمد على الكيس ابني.
والله استاذ هي يعني هذه البيشنت هي بال 2015 مشتغليها ليفت ماستكتومي، ف يعني جتي فوق يعني هذه هم يعني انه هي عندها نيو برزنتيشن اللي هو هذا الكف والديسنيه وهم فور فولو اب. فاحنا يعني شفنا تقاريرها كلها. اللي شفته انه يعني اكثر من سيتي مسويه، فشلون يعني انه اختلفوا بالدايجنوز. اكو من انطاها تي بي، اكو من انطاها انه هذه ديو تو كيموثيرابي، اكو من انطاها نيو ليجن نيو برايمري برونكوجينيك كارسينوما. فانا سويت يعني small talk about differential diagnosis of cavitary lesion of the lung.
اوكي دكتور احمد تفضل.
A cavitary lung lesion include a wide variety of benign and malignant entities. A cavity is defined as a gas-filled space seen as lucency or low attenuation area within pulmonary consolidation, within a mass or within a nodule. The radiological characteristic of cavity lesion is the wall thickness of the cavity lung lesion. So in solitary disease can be useful in differentiating between benign and malignant disorder. A new studies found a wall thickness of less than 7 mm was highly specific for benign disease, while thickness of greater than 24 mm was highly specific for malignant disease. However, these thresholds are not absolute, as thin-walled carcinoma are also reported. An additional indicator for malignancy was the lack of perilesional centrilobular nodule, whereas the perilesional consolidation was common around benign nodules. The second characteristic is the characteristic of the inner contour. So nodular or irregular, usually in case of neoplasms, poorly defined, shaggy, usually corresponds with abscesses, smooth cavitary lesion of other etiology. The number and location also important. Some locations guide to the possible etiology of the cavitary lesion. For example, lesions in the upper lobes are typically of tuberculosis. Solitary cavitary lesion is frequently found in pulmonary abscess, neoplasm, or post-traumatic lung cyst, etc. Multiple cavitary lesions suggest infection. The content of the cavities also important and is of little help in differentiating between benign and malignant lesion. Benign bronchogenic cysts may contain a fluid level as bronchoalveolar carcinoma, and also the degree of contrast enhancement. For example, the content of nodule enhanced less than 10 Housefield is shown to indicate benign lesion and may be used to distinguish aspergillomas from lung cancer. Rim enhancement is specific for abscesses. Connecting pulmonary artery may be seen in smaller metastases, but not in larger one, as the larger nodule tend to compress the vessel, so lack of feeding artery cannot be used to imply benign nodules. The acute onset of symptom sometimes help to distinguish between malignant and non-malignant disease, but a benign infection may, for instance, cause hemoptysis when affecting a nearby vessel. Benign disease may also cause fatigue and weight loss similar to malignancies. Acute onset of fever is usually helpful to distinguish between benign disorder from malignancy, but pulmonary cancer may present with a super infection secondary to the tumor. However, the combination of symptoms, laboratory results, past clinical history, and imaging finding leads to recognition of the correct diagnosis. Differential diagnosis of cavitary lesion is therefore very broad and include many types of infectious process, neoplastic pathology, for example, primary or secondary, and also many systemic disease. So we discuss some condition and we use the word cavity to help in differentiating between them. For example, C is for cancer, A is for autoimmune disease, V is for vascular, like for example, septic pulmonary embolus, I for infection, bacterial, fungal, or parasitic, and a trauma for T, and U, youth, which means congenital, refers to congenital. The first one, cancer, either primary or secondary. Primary neoplasm, for example, bronchogenic carcinoma cavitating about 10 to 15% of cases associated with worse prognosis, most frequently see squamous cell carcinoma. Typically is isolated cavity lung lesion, solitary, variable in size, irregular or speculated margin, thick wall, which is more than 15 millimeter, and associated with a mass and other findings like lymphoadenopathy, invasion of mediastinal structures, and thoracic wall. Air fluid level may be seen. Lymphoma and Kaposi sarcoma may also cavitate, especially in HIV positive population. And here, an example. This is a 65 years old female, and she's smoking, admitted for hemoptysis and malaise, no fever. CT show a large cavitary lesion with varying wall thickness. طبعا احنا بالكيس مالتنا نفس الشيء، انه يعني الwall thickness variable كان يعني مو واحد. This is another case with speculated mass in the left upper lobe with central cavitation corresponding with neoplasm. Secondary pulmonary tumor metastasis, against most frequently squamous cell carcinoma, account about 70% of the cases. It is variable sizes, usually multiple small lesions, thick irregular wall. We see it in adenocarcinomas, or thin smooth wall and regular walls, we see it in squamous cell carcinoma. Other primaries also can metastasize to the lung as cavitation. For example, gastrointestinal adenocarcinoma, transitional cell carcinoma of the bladder, sarcomas, cervical cancers. The cavitating pulmonary metastases have also been reported to develop after chemotherapy, thought to be secondary to tumor necrosis or valve effect on adjacent bronchi. اللي هذا احنا همين يعني اعتقد انه هذه الكيس مالتنا انه بسبب الكيموثيرابي.
بلى.
نعم صح. هذه هنا transitional cell carcinoma of the kidney. ونشوف الميتاستاسيس to the lung here multiple, and here one of the lesion is cavitating. Autoimmune disease. Many autoimmune systemic disease can affect the lung, but rarely are characteristic by presence of cavitated lesion. An exception is Wegener granulomatosis, which is systemic necrotizing vasculitis, affect the upper and the lower respiratory tract. Radiologically, there are multiple and bilateral nodules or mass, which may cavitate either by itself or by necrosis secondary to arterial occlusion. And this is an example of Wegener granulomatosis. The right lower lobe surrounding with thick wall cavitation and hypodense content. This corresponding with granulomatous mass. Rheumatoid arthritis, systemic disease related to connective tissue, which mainly affect women between 20 to 50 years old. These are most often located in the periphery and subpleural. They may vary in size and wall thickness. Normally, they are asymptomatic and resolve without specific treatment. But cough and hemoptysis have been reported in some cases, and this is an example. CT show multiple centrilobular nodule in the left lung inside the market area, which were bronchiolitis due to rheumatoid arthritis. In addition, a subpleural cavity nodule is seen. هذه اللي نشوفها, and this is after a month it's resolved by itself. Vascular causes of cavitary lesion in lung, for example, pulmonary embolism, manifest as pulmonary infarction that cavitate in 7% of the cases. The solitary subpleural indication, triangular morphology where the apex directed toward the lung hilum. This is cavitated consolidation in the right base with air fluid level. Air fluid level, and progressive disappearance in patients with thromboembolism, and seem to be triangular and toward the apex toward the lung hilum. The second cause is septic ombolism. These are multiple small nodules, 1 to 3 cm, with peripheral and subpleural location in the lower lobes and in various stages of cavitation. This is an example. Multiple and small, peripheral and subpleural. The third cause of vascular is organizing pneumonia, may cavitate in 6% of cases. Both clinical and radiological findings are not specific, so biopsy is necessary for definite diagnosis. هذه هي تكون عادة consolidation و thick wall cavity. The next one is infection, and the most common is pulmonary abscess. Pulmonary abscesses occurs as complication of pneumonia. Abscesses are seen on CT as cavitary lesion with or without a fluid level. They may occur anywhere in the lungs, usually intermediate to thick wall thickness, show rim enhancement, and necrotizing center is visible. If the abscess is located peripherally, there may be local pleural thickening or an embolemia. هذا هنا عندنا إنه lung abscess, ونشوف هنا air fluid level، وهذا اصلا enhancement. وهنا نشوف pleural effusion. هذا the same patient sagittal، وهذه عندنا pleural emphymia. هنا عندنا البلورا همين ماخذه enhancement. The next cause for infection is necrotizing bacterial pneumonia caused by Staphylococcus aureus, gram-negative bacteria, and anaerobic bacteria. They appear like pulmonary consolidation that can associate with cavitation. In the case of anaerobic bacteria, it is common to develop abscesses with thick wall, a regular wall containing air fluid level. هذه اللي جبناها. هذه after treatment, after antibiotic treatment صار الوول مالتها ثن.
بعد هواي عندك احمد؟ بعد هواي
برايمري لا استاذ باقي تحليلات. Post primary tuberculosis is the most common manifestation. 40% of the cases is the presence of infiltration with multiple satellite nodule and cavitary lesion. These findings are located peripherally in the upper lobes and in the apical segment of the lower lobes. Cavity can be both smooth and more irregular and thick, which occur more often. هذه الميلياري تي بي، وعندنا من cavitation هذه هنا. الفنجل انفكشن هي الاسبرجيلوماس، زين، اللي عادة الكوز هيستوبلازموسيس، blastomycosis and mucormycosis, especially in case of chronic disease and opportunistic fungal infection such as aspergillosis and cryptococcosis may manifest as cavitary lesion. Originally, this cavity may be invaded by aspergillus condition, the development of aspergilloma mycetoma, which have solid content and air forming the sign called air crescent. وهذه عادة يصير بجماعة اللي immune compromised patient. الباراسيتيك انفكشن اللي هي الهايداتيد، وهي يعني عادة إذا دخل الاير بالوول or inside the cyst راح ينطينا إنه cavitary lesion، وهي بهذه الساينات الليلي ساين والكريسنت ساين والمنسكس ساين. التروما عادة هي نيوماتوسيل thin wall وcontain air وسموث regular inner margin. اليوث for example congenital، عندنا الcongenital pulmonary malformation والpulmonary bronchogenic cyst. هذا عادة diagram for differential diagnosis according to the wall thickness between the cyst و between الcavity. وهذا يعني list بالديفرنشال diagnosis مع الكونديشن، خليتها إذا أحد يعني يحب يطلع عليها. Thank you for listening.